You wake up and your mouth feels like sandpaper. Your lips are cracked. Your tongue is stuck to the roof of your mouth, and the first thing you reach for is that glass of water on your nightstand. It happens every single morning. Maybe you have mentioned it to your doctor and they shrugged it off as just part of getting older. Maybe you have simply accepted it as one of those things that comes with age. But here is what most people do not realize. Waking up with a dry mouth every single day is not normal aging. It is your body sending you a very specific signal about something that is happening during those 8 hours you are asleep. And in adults over 65, that signal is almost always pointing to one of 5 distinct causes, at least one of which could be seriously affecting your overall health right now without you knowing it. I am Dr. Favor Adame, and this channel is dedicated to bringing you the latest evidence-based research on senior health in a way that is actually practical and easy to use. If you have not subscribed yet, I would encourage you to do that now so you never miss what we are covering. Now, let us get into what your dry mouth is really trying to tell you. Saliva is one of those things we take completely for granted until it is gone. Your body produces between 1 and 1.5 L of saliva every single day. It protects your teeth, neutralizes acid, helps you swallow, fights bacteria in your mouth, and even plays a role in digestion. When that production drops significantly, especially overnight, it is never random. Something specific is driving it. And in adults over 65, identifying that something can genuinely be life-changing. Let me tell you about a patient I will call Evelyn. Evelyn was 71 years old, a retired librarian who came to me complaining about morning dry mouth she had been experiencing for over a year. She had already seen her dentist, who recommended more water and a special rinse. The rinse helped slightly. The dry mouth came back every morning without fail. She had accepted it. Her husband had not. He was the one who pushed her to come to me. When I reviewed Evelyn's full clinical picture, the dry mouth was not the problem. It was the symptom of a problem. And once we identified the real cause, what we found changed her entire care plan. We will come back to Evelyn because her story is the reason this topic matters far more than most people realize. Before the 5 causes, here is the biology you need to understand. Saliva is produced by 3 pairs of major salivary glands: the parotid glands near your ears, the submandibular glands under your jaw, and the sublingual glands under your tongue. These glands are activated by the autonomic nervous system. During the day, chewing, tasting, and smelling all trigger saliva production. At night, saliva production naturally slows because the stimuli are reduced and the nervous system shifts into lower gear mode. This is normal. A mild reduction in saliva at night is expected. What is not normal is waking up with severe dryness every morning, cracked lips, a tongue that feels coated, or difficulty swallowing when you first wake up. These signs point to something suppressing your salivary gland function significantly beyond the normal overnight reduction. In adults over 65, there are 5 specific causes that account for the vast majority of cases. Some are as simple as a medication side effect. One of them is serious enough to require immediate investigation. Cause number 1, medication side effects. This is the most common cause of chronic dry mouth in older adults, and it is the one most frequently overlooked in routine care. Over 500 medications list dry mouth as a documented side effect. The most commonly implicated in older adults include antihistamines, antidepressants including SSRIs and tricyclic, blood pressure medications, particularly diuretics and beta blockers, bladder control medications, certain diabetes medications, sleep aids, and antipsychotics. These medications suppress saliva production by blocking the muscarinic receptors that signal the salivary glands to produce saliva. Because most older adults over 65 take multiple medications, the combined anticholinergic burden from several drugs can dramatically suppress salivary function even when no single drug is considered a major offender. Research published in the Journal of the American Geriatric Society found that older adults taking 5 or more medications had a significantly higher prevalence of severe dry mouth than those taking 2 or fewer. The condition is called polypharm pharmacy-induced xerostomia, and it affects an estimated 30 to 40% of adults over 65. What you should do: bring your complete medication list to your doctor and ask specifically whether any of your current medications are known to reduce saliva production. Ask whether there are alternatives with lower anticholinergic burden. This single conversation can sometimes resolve chronic dry mouth entirely. Cause number 2, sleep apnea and mouth breathing. If your dry mouth is severe in the morning and significantly better within an hour of being awake and drinking fluids, sleep apnea and mouth breathing during sleep are the most likely culprits. Sleep apnea is a condition where your airway repeatedly collapses or narrows during sleep, causing brief interruptions in breathing. Your body responds by opening the mouth and breathing through it. Mouth breathing bypasses the nose, which normally humidifies and filters incoming air. Dry air passing over the mouth and throat for hours every night evaporates the saliva film that should coat your oral tissues, causing the sandpaper sensation you wake up with. The connection between dry mouth and sleep apnea matters far beyond comfort. Untreated sleep apnea after 65 is associated with significantly elevated risk of hypertension, atrial fibrillation, stroke, and cognitive decline. Research published in the journal Sleep Medicine found that dry mouth on waking was one of the 3 most reliable predictive symptoms of obstructive sleep apnea in adults over 60, alongside loud snoring and observed breathing pauses. If you wake up with dry mouth and your partner reports snoring, or if you feel unrested despite adequate sleep hours, ask your doctor for a sleep study referral. The treatment, typically a CPAP device, usually resolves the dry mouth within the first week of use and dramatically reduces cardiovascular risk at the same time. If you have made it this far, you are clearly invested. You want to see what happens next, but most viewers enjoy the content and scroll away without subscribing. If this one really means something to you, tap subscribe. It takes a second. If not, you will probably forget this channel exists and miss a lot of great educational content ahead. Over the years in my clinic, I have seen something very simple make a real difference for people over 60. It is not about doing anything extreme. It is about doing the right small things every day. That is why I created a guide called 30-Day Blood Pressure Reset for Seniors. It is a simple step-by-step plan designed to help support healthy blood pressure through gentle daily routines, light exercises, and clear guidance you can follow at home. Some of my patients have used this same structure and told me they felt more in control of their daily habits and more confident about their readings. Right now, 10 slots are already gone, and I have 20 left. I am only allowing 30 people to go through it at this time because I want to follow up closely and see how each person is doing. If you feel like your current routine is not giving you the clarity you need, click the link in the description or scan the QR code on your screen to get your copy before the remaining spots are filled. And because you are part of this community, I have made it easier with a 70% discount so it stays affordable for you. After completing your purchase, please drop your email so I can follow up with you personally. I will check in through email and help you stay consistent with the plan. Also, I want to hear from you. Would you prefer this as a step-by-step video series as well, or do you like it better as a written guide? Let me know in the comments. Now let us continue with the remaining 3 causes. Cause number 3, uncontrolled or undiagnosed diabetes. This is the cause that most people never connect to their morning dry mouth, and it is one of the most important to identify. High blood sugar draws water out of the body's cells and tissues through a process called osmotic diuresis. The kidneys attempt to eliminate excess glucose by producing more urine, which increases fluid loss throughout the day and night. The mouth and oral tissues become dehydrated as part of this systemic fluid loss, producing persistent dryness that is most severe in the morning after hours without fluid intake. Research published in Diabetes Care found that xerostoia, the medical term for chronic dry mouth, was significantly more prevalent in adults with poorly controlled type 2 diabetes compared to those with well-managed blood sugar. The study found that blood sugar control was the primary determinant of dry mouth severity, not the duration of diabetes. Dry mouth as an early warning sign of undiagnosed diabetes is particularly important in older adults because thirst perception diminishes with age, meaning the usual signal that prompts people to drink more water and seek investigation is blunted. Dry mouth may be the only noticeable signal the body is sending. If your dry mouth is persistent, If you also notice increased urination, fatigue, or slow wound healing, request a fasting blood glucose test and an HbA1c test at your next appointment. Ask for both by name. Cause number 4, autoimmune condition called Sjogren's syndrome. Sjogren's syndrome is an autoimmune condition in which the immune system attacks the body's moisture-producing glands, primarily the salivary glands and tear glands. It causes severe persistent dry mouth and dry eyes simultaneously. Sjogren's syndrome is significantly underdiagnosed, particularly in older adults, where its symptoms are routinely attributed to medication side effects or normal aging. Research from the American College of Rheumatology estimates that it takes an average of nearly 3 years from first symptom onset to diagnosis. The condition is relevant beyond comfort. Sjogren's syndrome is associated with increased risk of non-Hodgkin's lymphoma, kidney complications, and nerve damage when left unmanaged. Early diagnosis allows treatment that reduces both symptoms and long-term complications. If you have persistent dry mouth alongside chronic dry eyes, difficulty swallowing dry foods, or frequent dental decay despite good oral hygiene, ask your doctor about testing for syndrome. The diagnosis requires a blood test for specific antibodies called anti-SSA and anti-SSB, alongside a clinical examination. Cause number 5, chronic dehydration. This is the simplest cause and the most frequently underestimated in older adults. After 65, the sensation of thirst becomes significantly less sensitive. Research published in the American Journal of Physiology found that healthy older adults responded to dehydration with a measurably weaker thirst signal than younger adults in the same state of fluid deficit. Many older adults are chronically mildly to moderately dehydrated, simply because they do not feel thirsty enough to prompt adequate fluid intake throughout the day. Chronic mild dehydration reduces saliva production consistently. It thickens the blood slightly, raising blood pressure. It reduces kidney filtration efficiency. It impairs cognitive function. And it produces the dry mouth you wake up with every morning as its most visible signal. The correct approach after 65 is not to drink when thirsty. It is to drink on a schedule. The goal is 6 to 8 glasses of water distributed evenly through the day, with the last glass approximately 30 to 45 minutes before bed. This timing ensures adequate overnight hydration without disrupting sleep with multiple bathroom visits. Keep a glass of water on your nightstand. The fact that it is the first thing you reach for every morning is your body confirming the deficit. I promised I would come back to Evelyn. Her dry mouth turned out to be caused by a combination of causes 2 and 4 on this list. Her sleep study confirmed moderate obstructive sleep apnea that had never been diagnosed. She was also found to have borderline syndrome antibodies, explaining why her dry mouth was more severe than sleep apnea alone would account for. She was fitted for a CPAP device. She was referred to a rheumatologist for the Sjogren's evaluation, and within 6 weeks of consistent CPAP use, her morning dry mouth had reduced from severe to mild. She came back to tell me something that stays with me. She said, "I spent a year thinking this was just something I had to live with. I did not know my body was trying to tell me 2 different things." That is always the answer. The body is not just complaining, it is communicating. And every one of the 5 causes on this list is a message worth listening to. Let me bring the 5 causes together clearly. Waking up with dry mouth every morning after 65 can mean medication side effects from anticholinergic drugs suppressing salivary gland function. Sleep apnea causing mouth breathing that evaporates oral moisture overnight. Uncontrolled or undiagnosed diabetes drawing fluid from your tissues through osmotic dehydration. Sjogren's syndrome, an autoimmune condition attacking the salivary glands, or chronic dehydration from the blunted thirst sensation that comes with age. Your action step is this. At your next medical appointment, bring up your dry mouth specifically and ask your doctor to review these 5 possible causes against your personal history. Do not accept it is just your age as an answer. It may be, but it may also be a treatable condition that deserves investigation. Which of these 5 causes sounds most relevant to your situation? Tell me in the comments. I read everyone, and if someone in your life has been dismissing their morning dry mouth as normal aging, share this video with them. It may be the prompt they need to find an answer they have been missing for months. Before you go, I want you to think about something. Most people keep waiting for the perfect moment to take their health seriously, but that moment usually never comes. That is exactly why I created my guide, 30-Day Blood Pressure Reset for Seniors. It is designed to give you a simple step-by-step daily routine you can actually follow without confusion or stress. Inside, you will find gentle exercises, daily habits, and a clear plan you can stick to day by day. Right now, I am keeping this very limited. Out of 30 slots, 10 are already gone and only 20 slots are left. Once those are filled, I will be closing it. If you feel ready to start something simple and structured, click the link in the description or scan the QR code to get your copy now. And because you are part of this community, like family to me, I have added a 70% discount so you can get started without worrying about the cost. After completing your purchase, please drop your email so I can personally follow up with you. I will check in and help you stay consistent with the plan. And one more thing, I would really love your feedback. Would you also like this guide in a video format, or do you prefer it as a written guide? Let me know in the comments. Disclaimer: everything shared in this video is general medical and educational information based on current published research in geriatric medicine, sleep medicine, and oral health. It is not personal medical advice for your individual situation. Dry mouth can have multiple causes, and only a qualified medical professional can properly diagnose and treat the underlying condition. If you are experiencing persistent dry mouth, please schedule an appointment with your doctor and bring the information from this video to that conversation as a starting point.